Exactly. That is exactly what they're focused on right now, and specifically anything that we might need that will help fight the Omicron variant, specifically PPE. These days, when you go to the store, there are no guarantees you will find what you're looking for.
Nothing extra for the holiday. I mean, there's just been ongoing things that I used to buy that I can't find.
For that, you can blame the supply chain. Over the last 2 months, ports like those in California have seen a backlog of cargo ships. Just last month, President Biden required those ports to remain open 24/7 to catch up on the backlog,
which meant that people were able to move goods from the ship to the shelf a lot faster.
Christopher Mayer is the White House Deputy Press Secretary. He says the president's focus is on the supply chain, especially as Omicron threatens to overwhelm our hospitals and daily life.
We're going to make sure that people have access to that and that there's no bottlenecks in PPE and COVID-related goods getting to where they need to go as well.
As for shoppers, they hope to avoid another March of 2020.
I'm hoping we've grown. I am a little concerned. So we simply have to make adjustments and, get through it the best we can. I don't think that worrying or complaining is going to help.
So it probably doesn't come as a surprise, but the biggest issue shoppers we ran into today say they were having a hard time getting their hands on was the COVID-19 at-home tests, of course. Now, so the big question from a lot of folks we're hearing is the White House ramping up their at-home testing impacting us here locally when it comes to picking up your own test at a pharmacy or store? I asked the White House that question today, and I got that answer for you. It's coming up tonight at 6 o'clock.
Well, we'll see. Washington County's big vaccine clinic over at Tektronix will close after tomorrow. So the county did open up a few other spots for people to get vaccinated ahead of the holidays. That's including this one here at Templeton Elementary. This vaccine clinic will stay open tonight for just about another hour. It closes at 7.
It's nearly 2022 and COVID is still thriving. Outside the convention center, people waiting to be tested. Christmas just 3 days away.
We absolutely want to get as many people boosted as possible.
In Tigard, a more encouraging cue. Oregonians lining up for vaccines. This clinic at Templeton Elementary was recently added to make up for upcoming clinic closures during the holiday.
Should we be operating these facilities despite the holidays if we need people to get boosted and vaccinated as quickly as possible?
We had set up the holiday schedules for these sites before the Omicron threat showed up here in Oregon. We have actually made adjustments to those schedules.
Dr. Kristen Dillon is a senior advisor for the state's COVID response. She says OHA has added makeup days and noted another reason to stay closed on Christmas.
We also understand that the burden this pandemic has placed on healthcare workers is extraordinary. And we've got to be balancing the well-being of our healthcare workforce at the same time that we're balancing reaching Oregonians with boosters.
Dr. Dillon says there likely won't be a lot of interest in vaccinations on actual holidays anyway.
And it just means we need to pick up the pace that much more on the other days.
In early January, OHA is planning to open 3 more vaccine clinics. At the county level, local governments are also trying to ramp up vaccinations. Clark County saying it's focusing vaccine efforts on high-risk populations. Washington County is adding vaccine clinics and hoping to double its daily vaccination rate. And Multnomah County will close clinics this Friday and Saturday, but next week they're hoping to open a brand new one.
Now, OHA started this goal to vaccinate to boost 1 million Oregonians by the end of January on December 17th. And new information we got in late today from OHA says before that challenge started, there were almost 1 million Oregonians who had had their booster. OHA says they're still needing 903,000 Oregonians to get boosted to meet that end of January goal. Yeah, by the minute, it seems. At 2 o'clock, I went online to Walgreens to try and find another one of these Binax Now at-home COVID-19 test kits. There are only 3 stores relatively close to me that said they had them in stock, including this Walgreens off of Farmington in Beaverton. Well, I got here just about 10 minutes ago, and when I walked inside the store, this is what I saw. Signs all over the store saying that this Walgreens location is out of the testing kits.
This was Walgreens' website Tuesday afternoon. I was trying to find a Binax Now at-home rapid test available for pickup near Lake Oswego. Look at the results. Stores in Tigard, Beaverton, Gladstone, Happy Valley, Sherwood, Portland, nothing. Only 3 stores said they had stock. I asked OHA this question Tuesday. What is the state doing to make testing more available and free? Those Binax Now test kits cost about $25. OHA told me it's standing up more testing sites in the state and is also sending rapid test supplies to providers and schools. One of OHA's huge partners in this is Curative. There are about a dozen Curative test centers in the greater Portland area. Some of those recently expanded operations.
A new modality that we just started in the state of Oregon, outside of all other states in the Pacific Northwest, is our rapid PCR modality, which enables us to do a PCR test and get results within 2 hours.
PCR tests are the gold standard of testing for COVID right now. Dr. Jennifer Vines, the health officer for Multnomah County, doesn't think testing needs to be a prerequisite for holiday gatherings if people are vaccinated, boosted, and feeling well. But
things are going to be changing as we learn about Omicron, and I think we'll have more to say about the role of testing in the days and weeks ahead.
As my brother said in our family group chat today, testing kits are the new toilet paper. Coming up at 5 o'clock, how accurate are these tests, specifically the Binax Now test? I just found a new study that was done this month. We'll share the results for you in an hour.
Well, Kelly, staff here tell me the current protocols seem to be working. Masks are required and you need a vaccine card or negative test to get in the door. The Center of the Arts director says her message is to support these shows while utilizing safety measures.
The Portland 5 Centers for the Arts just canceled their first show due to a breakthrough case. But the director here says with the available tools, they plan to move forward with the season.
We're trying to stay optimistic, but at the same time, we're like, please go get vaccinated.
Staff at these venues are communicating with the Broadway League, determining potential impacts on local shows for the months ahead.
It's unsettling to see so many performances cancel. We still have 2/3 of the shows in New York that are up and running with no problems. And it looks like the shutdowns are a fairly short duration.
Both the Center for the Arts and the Live Events Coalition of Oregon are worried about public perception. Dwayne Thomas says even without a government shutdown, it's ultimately the community that impacts business.
You don't have to look far to see also business events will go, well, if they're not going to gather, then we really shouldn't either, because we actually have even more to lose.
Thomas says the Delta variant led to cancellations in the fall. Many pushed events into early 2022. Now, those are at risk as well.
We haven't seen a lot of the wedding world canceling. We have seen business parties, holiday parties canceling en masse. But the small private events, much like this summer, may just continue on.
Other venues like Revolution Hall tell me they're also utilizing tools like masks and vaccine cards to stay open. That site is taking it one step further by offering free COVID-19 testing at the door to encourage public safety.